The PRSB is an organisation that develops standards to support sharing of information in health and social care to help provide safer, better care for people. This film is going to show some examples of the work that PRSB has been undertaking, particularly with members of the public, with patients, with carers, with people who use services.
My name is Sabine Qureshi and I'm mother of a 7-year-old child who has additional needs, and as a result of some of the issues I faced in trying to get support for him and his needs, I've become involved in a digital child health project. Because my son has lots of meetings with different professionals, so psychologists, occupational therapists, speech and language therapists, and also meetings at school about the best way to support him, there's a very large volume of paperwork. I've got literally a small suitcase full of paper, another box full of paper that I need to have access to. If I could access these records online, it would just be a huge weight off my mind, because it's such a burden, just the thought of having to think about going through all the paperwork. So to be able to let go of all that, it would just be a complete relief for me and my family. I was invited to attend a workshop by the PRSB where I could give my feedback on their proposals, and I was really excited to do this because it just felt like they really value the engagement of parents, and to be treated on the same level as all the professionals as a parent, for my opinion, to be taken into account. That really felt great actually, and I felt like we were all working together as a team.
We are quite a busy community pharmacy, doing a lot of services and a lot of prescriptions. We do about 1,000 prescription items a day. We've been using e-discharge for the last 1.5 years. When we receive the discharge, we ring the patient straight away, check if they're okay and if we can help with anything medicine related. If there's any discrepancies at that stage, we get in touch with the patient's GP or resolve it with the patient themselves. We then make sure that they've ordered the medication and they've got enough of them as well. It's been a massive benefit to all of our customers or patients that have used the service. Traditionally we were reliant on them bringing the information to us. That didn't tend to happen. Now that we get the e-discharges, most of our customers that go into hospital, we're aware that they've come out the day that they are discharged. Part of the service as well then is that we ring them in another month's time. We do a full medication review with them, so there's a good pathway of looking after the customer. Because of the e-discharge, we do this with almost everybody that's discharged from hospital. Whereas 1.5 years ago, we didn't do many at all because we weren't given the information. So the main benefit of this service is that we are taking responsibility for the patient's medication at a time when they're very vulnerable, and making sure that what changes have taken place in the hospital are actually being carried out in practice.
I'm a parent carer for Andrew, who's 27 years old. Has autism and also mental health problems. Throughout his childhood, we had many different professionals involved in actually his care. At one point, I think I counted 18 different professionals, and there was never one plan, ever. A lot of the time he feels very anxious and very socially isolated, so he often comes back home. In terms of his support, it's quite fragmented. And actually I'm the main coordinator of all the information flows between services. My main premise is that the support plan should be holistic, and it should encompass not just social care but also healthcare provision, mental health care provision. We've worked for many years to try and build up a supportive network of services for Andrew. My recommendation would be that there's a key worker system, and I think many of my friends who are parent carers would agree with that. If this happened, if we had a well coordinated care plan, it would be very helpful.
We have been using electronic care records for nearly 11 years now, and one of the major developments recently for us has been implementing a new discharge summary format, which is consistent with the guidelines from PRSB. The process creates a draft discharge summary which has been saving considerable time for the junior doctors who previously had to prepare the discharge summary manually. The junior doctors tend to be on the front line or the coal face, as the proverb goes, and the new format has saved them on an average 30 minutes per discharge summary. And if you consider that in a typical busy ward, a junior doctor has to do at least between 4 to 6 discharge summaries a week, giving them more time to attend directly to the patient care is a huge benefit. Looking ahead, the challenge now is how we move away from the current paper format and deliver the same discharge summary almost in real time as soon as the patient leaves, so that all parties who then support the patient in the community are immediately aware for continuing care.
The PRSB is really interested in hearing from organisations that are implementing our standards and hearing how we can support you. So please don't hesitate to get in touch. We'd love to hear from you, and hopefully we can work together to help support better, safer care for people.